how to soothe your baby. We all want a baby that doesn't cry very much, but it's important to remember that if baby's crying, it's because they're trying to tell you something. They're not trying to be a pain in the bum. They're only trying to tell you that they have a need for their survival that they're asking you to fulfill, okay? So some things that you can do if baby is upset. Firstly, skin to skin. This is where your baby feels the safest and the calmest. And if baby's hungry, then this is the first step to feeding anyway, which is the next step. So feeding. A lot of the time, if your baby is crying, it's probably that they want to feed. And if it's not for hunger, it might just be for comfort. So like we speak about in the breast milk section, breastfeeding is pain relief for baby, it's comfort for baby, as well as nutrition. So, offering baby a feed if baby's really upset to help them calm down is absolutely perfect, okay? The next thing that you can do is to burp baby or wind baby. So babies, when they have a tummy pain, and it's really common for babies to get a tummy pain or wind pain, they will generally do this very high-pitched cry because it's a really painful sensation. So a hunger cry babies will generally, again, work up to. They'll show increasing movement and all of the things that we talk about in the hunger cues section, and then they'll start to cry. But for a wind pain or a gut pain, baby might be perfectly happy and settled and then all of a sudden do a really high-pitched cry where they're pulling in their legs or arching their back. And so gently patting baby's back, popping baby over your leg, and rubbing baby's back, patting baby's back, holding baby upright and patting baby's back while supporting around their neck and their chin are all really good ways. Popping baby over your shoulder upright and patting baby's back there as well, because that pressure on baby's tummy helps them, as well as that patting to pass the wind. Another great way to soothe your baby is to offer a nice bath, okay? And sometimes for wind and gut pain, this can be really helpful as well. But even if it's not that, sometimes a nice bath can actually kind of snap them out of whatever it was that they were upset about. Then generally after a bath, baby will be tired and have a nice feed, and then hopefully will have settled for you. And so sometimes a nappy change as well might be enough. Some babies don't really care if they've got a wet or soiled nappy, but some babies are very sensitive to it. So changing bubby's nappy might also be a way that your baby might settle. And it's also important to remember that your little baby also has emotional needs that need to be met as well, not just physical, okay? And for a baby, they absolutely feel scared and frightened and sad. And so doing things that mimic what life was like in the womb for baby is really, really comforting for them. So that's why things like swaddling baby up nice and firmly, because baby was all nice and tight and squished inside of mum's tummy, that is super, super calming for your baby, okay? So some other things are the shushing sound, because that mimics the placental noises that baby was listening to inside of mum's tummy. So that's that shh, shh, shh sound, really soothing for bubbies. Swaying as well, and patting and rocking, because when baby was inside of mum's tummy, and mum was moving around all day long, that's what was happening. Baby was being swayed from side to side, and it is perfectly fine to do this for your baby, okay? There's lots of advice that you're going to make a rod for your back and all of this kind of stuff, but it's actually age appropriate and it's perfectly normal. In fact, your baby needs it for their emotional development, okay? And emotional security, which is really important for your bubby. So please don't be afraid to pat and sway and shush and cuddle and sing to your baby and do all of those things that mimic that life inside of the womb, like what we talk about in the 4th trimester video. So if you've tried all of these things, then I'm sure that you will find that baby should settle. But if you're worried, if nothing is working and baby's been unsettled for quite a period of time and you're concerned, please don't ever hesitate to contact your medical professional.